Hello everyone, now let us discuss about 2023 NM changes for inpatient or observation consultations. So whether it is an established or a new patient, the codes 99252, 99253, 99254 and 255 are used to report physician or other qualified healthcare professional consultations provided to hospital inpatients, observation level patients, residents of nursing facilities and patients in a partial hospital setting. And whenever advanced practice nurses and physician assistants are working with the physicians, they are considered as working with physicians in the exact same specialty and subspecialty as the physician. One more important point is only one consultation may be reported by a consultant per admission, and subsequent consultation services during the same admission are reported using subsequent inpatient or observation hospital care codes. Only one consultation may be reported per consult per admission, and the subsequent consultation services by the specified physician during the same admission, that is during the same hospital stay, are reported using subsequent inpatient or observation hospital codes that come under the category 99231 to 99233 or subsequent nursing facility care codes that come under the category 99307 to 99310. Subsequent consultations must be considered as regular inpatient visits or nursing facility care visits. And for an inpatient or observation consultation requiring prolonged services, you need to use 99418. We will discuss in detail when we talk about the prolonged services. As for now, for an inpatient or observation consultation requiring prolonged services, you need to use 99418. And the important change in 2023 is 99251 code has been deleted, and to report that you need to see 99252. Previously it was 99251 was there, now it is deleted. So as of now the inpatient or observation consultation codes are mainly four codes. First one is 99252 which requires straightforward MDM. Next is 99253 which requires low MDM. The next is 99254 which requires moderate MDM. The next is 99255 which requires high MDM. And the code assessment is mainly based on the medical decision making MDM, not on history and examination. Now coming to the first code 99252. The description is for a new or established patient which requires a medically appropriate history and or examination and a straightforward medical decision making. Whenever MDM is considered, it should be straightforward. And whenever time is considered for code selection, 35 minutes must be met or exceeded in order to code 99252. Coming to the examples of 99252. Here, a straightforward MDM is required. So the first example is initial inpatient preoperative consultation. Preoperative consultations are nothing but the regular visits which does not require much attention before the procedure. So initial inpatient preoperative consultation for a 43-year-old female with cholecystitis and well-controlled hypertension. This can go under straightforward MDM and the example can be 99252. Next is initial inpatient consultation for recommendation of antibiotic prophylaxis. Here the antibiotic is given prophylactically for a patient with synthetic heart valve who will undergo urologic surgery. This is also comes under straightforward MDM, so you can assign 99252 for both these cases. Now coming to 99253 for a new or established patient which requires medically appropriate history and or examination and a low level MDM. 253 indicates low level MDM. And whenever time is considered as a governing factor, 45 minutes must be met or exceeded in order to assign 99253. Now let us see example. Initial hospital consultation for a 22-year-old female, paraplegic. Here patient is having a chronic condition, paraplegic, to evaluate wrist and hand pain. So this comes under low complexity and low MDM can be given. Next example, initial hospital consultation for a 40-year-old male with 10 days history of incapacitating unilateral sciatia. Unable to walk now, not improved by bed rest. Since 10 days, patient is having incapacitating unilateral sciatia and now the condition is not improved. This will also go under low level of complexity in case of MDM, and you can quote 99253 for both these examples. Next, coming to 99254. For a new or established patient which requires a medically appropriate history and or examination and a moderate level of MDM. Here the MDM level should be moderate. For 99253 it is moderate. And whenever time is considered as the governing factor, 60 minutes must be met or exceeded in order to code 99254. Now let us see example. Initial inpatient consultation for 35-year-old female with fever and pulmonary infiltrate following a C-section. Here, following a procedure, the procedure complication codes, they generally lead to moderate complexity. After following a C-section, the patient is having a complication, fever and pulmonary infiltrate, that must need an immediate attention, medical attention. So this comes under moderate level of MDM. So you can quote 99254. Next, initial hospital consultation for a 62-year-old female with metastatic breast cancer to femoral neck and thoracic vertebrae. Usually cancer, that too metastatic breast cancer to femoral neck and thoracic vertebrae. This moderately increases the risk, and cancer comes under chronic condition, and metastasis means that the condition has progressed or worsened condition. So this also comes under moderate level of MDM, and you can quote 99254 in both the cases. Next, coming to 99255. For a new or established patient which requires a medically appropriate history and examination and a high level of medical decision making. High. MDM should be high in order to code 99255. And whenever time is used as a governing factor, 80 minutes must be met or exceeded. In order to code 99255, a minimum of 80 minutes must be met or exceeded. And for the services which require 95 minutes or longer, you need to use prolonged services code 99418. Whenever the time taken is 95 minutes or longer, instead of inpatient consultation, you need to use prolonged services code, that is 99418. Now let us see examples for 99255. Initial inpatient consultation for a 76-year-old female with massive life-threatening gastrointestinal hemorrhage and chest pain. This is massive, aggressive, life-threatening, high risk of morbidity, life-threatening gastrointestinal hemorrhage and chest pain. So this goes to high level of MDM. Next example, initial inpatient consultation for a 75-year-old female admitted to intensive care unit with acute respiratory distress syndrome, who is hypertensive and has moderate metabolic acidosis and also rising serum creatinine level. Patient is having moderate metabolic acidosis and rising serum creatinine level, which requires immediate medical attention and also has a acute respiratory distress syndrome and is admitted to ICU. So all these things, they contribute to the high MDM, and you can quote 99255. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.